Hello friends, I am Dr. Panipriya, Specialist General Surgeon from Prime Hospital, Dubai. I would like to speak a little bit more on evaluation of a breast lump. If you remember, I had spoken about how breast lumps are found, how they are the causes for breast cancer. Today, I would like to speak a little more about the evaluation. The three steps are: 1. A complete detailed history and clinical examination by the surgeon. The second is a radiological assessment which include ultrasound of the breasts, mammography, and sometimes even an MRI of the breast. The third, the most important aspect of the evaluation is a tissue diagnosis. Tissue diagnosis consists of FNAC, also called as fine needle aspiration cytology, core biopsy, and excision biopsy. A detailed clinical evaluation consists of a questionnaire by the surgeon into various aspects of your life, which could be when the lump was identified, how it progressed, also a little bit more about your other breast ailments, breastfeeding patterns, menstrual cycles, breast pains, family history of any cancers, particularly breast and ovarian cancer, and also whether any hormonal supplements have been used for various reasons. Physical examination by the surgeon. Once a detailed history is taken, then the next step of radiological assessment would be done. The most commonly performed radiological investigation is an ultrasound of the breast. An ultrasound is not harmful at all for the patient. It can be done multiple times without any harms. Why I am saying this is the next radiological assessment is a mammography. Mammography is an X-ray of the breast. Yes. Now comes the concern. Should I undergo a mammogram? Is it safe for me? What are the harmful effects of mammography? I will address this a little later. The next is the MRI of the breast. Ultrasound is required to identify certain conditions of the breast which are commonly found in women who are less than 40 years of age, particularly the cysts. Cysts are not easy to be identified on an X-ray or the mammography. Mammography is advised only in those patients where the clinical evaluation and the early ultrasound findings are suspicious. It would be right to say that a mammography is advised when there is a suspicion of any cancers. The most common question a woman asks me is, why should I undergo a mammogram? Is it safe for me? And what are the harmful effects of radiation? Let me ask you a simple question. If a doctor asks you to undergo an X-ray of the chest, will you think twice? No. But when a mammography is advised, there is a lot of concern, right? Okay, let me give you situations where mammography is absolutely essential. Now, as per WHO guidelines, mammography is the only screening method to detect breast cancers. particularly in women after the age of 40 years, which means mammography can be done as a screening method for women after the age of 40 years. A woman less than 40 years, mammography should not be done as a routine evaluation. Ultrasound is the preferred method to identify or evaluate a breast swelling. Mammography will be advised when there is a suspicion of cancer based on the clinical evaluation and the ultrasound findings. So, where a woman so where a woman needs a mammography, she should undergo, irrespective of her age. Then comes the next radiological assessment, which is an MRI of the breast. MRI means magnetic resonance. Now, mammography is better than an MRI to identify cancers. The use of an MRI of the breast is restricted to a very small proportion of patients where the ultrasound and the mammography are not giving conclusive diagnosis. So, let your surgeon decide whether a mammography or an MRI of the breast is better suitable for you. After the radiological assessment, we come to the third step, which is a tissue diagnosis. A tissue diagnosis gives us a closer and a more accurate information about the nature of the breast swelling. The least invasive of the tissue diagnosis is an FNAC, which is fine needle aspiration cytology. Either the surgeon or the pathologist would insert a small needle into the breast swelling, aspirate a little fluid or some cells, and examine under the microscope to know the nature of the swelling. Most conditions can be diagnosed by this simple procedure. When there is a very high suspicion of cancer and an FNAC is not able to give clear picture about the cancer, then a core biopsy is advised. In core biopsy, a bigger and a thicker needle is passed through the swelling, sometimes under ultrasound guidance, to extract a bigger chunk of tissue. The bigger chunk of tissue is now subjected to various examinations so that a proper diagnosis of the breast swelling can be done. Now, what is an excision biopsy? The earlier two investigations, FNAC and core biopsy, have a limitation of accessing only one part of the swelling, depending on the size of the needle. So, it is possible that even if there is a cancer, sometimes FNAC and core biopsy may not pick up. It doesn't mean that the person who did the procedure is incapable. It is perfectly expected that sometimes these two investigations may not give us the correct information. So comes the next investigation, which is an excision biopsy. Excision biopsy is a surgery which requires anesthesia, and it is the most invasive part of the investigation. It is the last option given to the patient. So friends, today I've tried to cover how you go about diagnosing a breast swelling. And I've also tried to answer a few questions about the safety of mammography and radiation exposure. I hope my talk has given a little bit more value to whatever your knowledge and your concerns about these investigations were. If you have more questions, I would be very happy to answer them. Please post them and I will answer. Thank you. Bye. Next time, I may talk a little bit more about how we treat breast swellings. Bye.